like to tell you about a condition called PANDAS Syndrome, and it's short for Pediatric Autoimmune Neuropsychiatric Disorder associated with Streptococcal Infection. I know it sounds quite a mouthful. One of the members asked a question in the group about PANDAS Syndrome, and the reason I think it's come up on a site and a group page like mine, which deals with ADHD and developmental problems, because often there can be a confusion between the symptoms and signs of ADHD and PANDAS syndrome. And there are a lot of patients that sometimes think that these symptoms are due to PANDAS syndrome and not ADHD. So I'd like to clear this up and talk about it. PANDAS syndrome is basically related to a strep infection between the ages of 3 months and puberty in a child, where a strep infection is a very ancient bacteria, and it gets into the passages of the respiratory tract, and it hides and it kind of mimics the other cells in the human body. And the body initially doesn't really understand where it is. And then the immune system suddenly gets the hang of things and starts to make antibodies against the covering of the bacteria. And it makes those antibodies, but at the same time, it makes antibodies, and this bacteria has mimicked other tissues in the body. And your body then, or a child's body then, starts to make antibodies, not only against the bacteria, but also against other organs in the body. In the past, you've heard of rheumatic fever. Rheumatic fever is where there's a confusion that causes antibodies against the heart valves. That is something that's almost been eradicated because we understand this, we treat infections very early. There are also autoimmune diseases where the kidneys can be affected, the joints can be affected. We also see children with irritable hip against the joint capsule. And then there can be a situation where the body creates antibodies and it's against the brain structures, something called the basal ganglia, which is responsible for movement and mood. So some of the symptoms that can start off, and the difference between PANDAS syndrome and ADHD is distinct. Someone with ADHD is a long-term issue. It happens over a long period of time. The symptoms and signs happen over many years. There's a genetic trend. There's a specific behavior, impulsivity, hyperactivity, inattention that happens over a long period of time. PANDAS syndrome is out the blue. It is a child that can have obsessions like OCD symptoms, suddenly out the blue, a child that is behaving absolutely normally, and then suddenly, like a lightning bolt, changes. They can also have motor tics. They can also have behavior issues. Children can be confused with just being difficult, suddenly crying, unhappy, particularly when a child's young. They can't always tell you about those symptoms. These problems are overnight. They can include motor tics, vocal tics, obsessions, compulsions, and a child can become just moody and irritable, experience anxiety attacks, and show concerns about separating from their parents. So this is due to something called an autoimmune condition. There's a relationship and a link between an infection. It can be due to other infections, but specifically Streptococcus. So that is the big difference between ADHD and PANDAS. It's almost like a cross-reactivity of antibodies against your own kind of structures in your body. But this is about mental or kind of emotional symptoms. Now, it's very rare for this to happen after the age of 12 years. So it doesn't really happen and unlikely to happen in adults. But I suppose nothing's impossible. So the signs and diagnostic criteria are the presence of OCD, tic disorder, or both. And it has to happen in the pediatric group between the ages of 3 months and puberty. And it's sort of episodic. In other words, it can happen in little bursts. So it might happen and then fade over several weeks. And then if there's another strep infection, the symptoms come back. and it's associated with something called beta hemolytic strep, basically the strep throat that we all know about. And the symptoms can also cause like physical hyperreactivity, unusual little jerking movements, unusual movements that a child has. Now, this is a very rare disorder, and the National Institute of Health put it down in 1 in 30,000 children, which is a lot. But the PANDAS sort of organization online put it down as common as 1 in 200. And they actually kind of comment that they think it's almost every child that has a motor tic is almost kind of 20% of all children who have motor tics actually is due to PANDAS syndrome. It's a difficult thing to diagnose because you've got to suspect it. You've got to do tests, throat swabs, sometimes blood tests showing there's a rise in the infection recently from PANDAS syndrome. So, these symptoms are symptoms that can sometimes create joint pains, make a child's handwriting untidy, coordination issues, problem with suddenly bedwetting, or having difficulty, or just having accidents during the day. I've seen children which have just suddenly had little movements, wetting themselves during the day, behavior outbursts. Everybody thinks there's something at school, something at home. It's out of the ordinary. They suddenly have trouble sleeping, mood, irritability, tendency just to cry and laugh, emotional, up and down, and also can be very clingy. And these episodes can happen when there are exposures to lots of infections like children get. But, remember, a child can have OCD and have motor tics and PANDAS syndrome, which makes it a bit more complicated. So I thought I'd just bring this to your attention because one of the members had brought it up. And, I've seen several children over my career with this problem, and it's important to not ignore it and not kind of just dispel it as just something else. So I think doctors need to not just ignore this problem. And, the treatment is treating with antibiotics, treating the infection so that the stimulus or the cause of the problem goes away. Throat swabs, and also to follow children up, and also to make sure they don't have other problems. Make sure that those motor tics are not seizures or other particular problems. Needs of specialists to be able to investigate. And remember, obviously with the emotional issues, psychologists, support, all those kind of things are important. But it's important not just to put your child down to having an anxiety attack, then go and put them onto tranquilizers and antidepressants. It's important to think about all these things. And there are lots of support groups related to this, but it's generally a very rare condition, but very important and not to be ignored. And, parents often say, my child keeps getting infections, can I have the tonsils out? No, you don't need to do that. You can still get a throat infection even though you take the tonsils out. So there's a lot of research that's been happening around these issues. So I hope this sort of helps you understand something about PANDAS syndrome.